Hi, I'm Dr. Greg Gonzava. I'd like to discuss the different medications available for the treatment of type 2 diabetes. There's several, so I'd like to discuss each one. First and foremost, Metformin. Great medication. I believe it's the #1 medication used in the world for diabetes. Works very well. It stops the body's ability to make sugar from the liver. Very well tolerated. However, it should not be used in people who have significant kidney problems. It does not cause kidney problems, but it should not be used in those people. Main side effect that is reported is GI side effects such as diarrhea. Next, medications like glipizide, glimepiride. These medications stimulate the pancreas to produce more insulin. Very effective, very affordable. However, we have to be careful with low sugar or hypoglycemia and should not be used in patients that have sulfonylurea allergies. Thirdly, TDZ class, medications such as Actos, also effective. Effective in lowering blood glucose. However, there are potential side effects we should look out for, such as lower extremity swelling, fluid retention. Should not be used in people with heart failure because they can cause or exacerbate congestive heart failure, and there's an association with weight gain. There's a very mild association with bladder cancer, but I believe it's fairly insignificant and the medication is widely used. Next class is DPP4 inhibitors, medications such as Januvia and Tradjenta. Also effective, not horribly strong in reducing A1C, used as add-on with other medications or in people with a slightly elevated A1C or blood glucose. The next class is SGLT2 inhibitors such as Jardiance and Farxiga. Very effective, very good for cardiovascular disease, very good for renal disease, very good at lowering blood glucose. They work by taking sugar out of the blood and putting it in the urine. So some people urinate more and are prone to urinary tract infections. Great medications, however, they're not generic, so there can be a price consideration. And lastly, there's GLP-1 inhibitors such as Ozempic and Mounjaro. Once-a-week injections, great for glycemic control, great for cardiovascular, and great for weight loss. Very well tolerated. Some people get GI side effects. We have to watch out for that. Also, they're not generic, so price can be an issue. I hope that helps clarify the different classes of diabetic medication for type 2 diabetes. There will be more information on my website. Thank you.